I'm Jared Barnett. I'm a student at Oakland University, mastering in public health, and I'm from Pontiac, Michigan. Just Ghana, they had a public health program to study abroad, and it just seemed exciting. They showed us some videos about it, explained the program. It just seemed like a great opportunity, and I work in public health. I'm a community health worker by trade, I guess you could say. And yeah, everything just aligned. I'm still fairly young and the time seemed right to go and visit Ghana. When I first arrived to Ghana, just the pace of everything seemed fast. The cars were going fast. The people either were going to or from somewhere. It seemed like everybody was actively doing something. So it just seemed super fast paced. You had to be on your toes. And yeah, it was, it was a bit of a shock, but the more time I spent here, it slowed down a bit and could really understand things a bit more. Yep, so typical day, we wake up early. We had an itinerary of different activities. We may be going to a nature center, and we had to kind of prep, get each other together. You know, we may meet with Dr. Sachi before and kind of get a debriefing on what we would do that day. And yeah, we would go out. Usually we would do an activity, share a meal together, reconvene, and it seemed like we always checked in with each other and made sure everybody was doing okay, and you know, we were enjoying our time, whatever we were doing. Just, it seemed like every day was its own day. We had different activities. One day we'll be at the hospital visiting staff, doing different healthcare related things. The next we'll be visiting a local school and meeting with kids and teachers. Another day we'll be visiting a museum. So the days were long and jam-packed, but they were exciting and really fulfilling. The experience with the community in Ghana, it's been super positive. Everybody seems so welcoming. Even though it's fast-paced, they don't mind being patient with you and explaining the culture and the norms here. I think I got a chance to learn a lot from the community. The cultural differences between Ghana and the U.S., I would say in the U.S. it's more of a melting pot of different cultures who contribute to the American culture. But in Ghana, I feel like it's more of a rich history. Cultural practices I've found interesting, it's just people welcoming you into their homes. In America, I don't think people are as welcoming to letting you in and, you know, I think cooking a meal for you and just being so gracious. It took some time to get used to, but that was, I really enjoyed being, you know, included in the culture, and, you know, it was welcome with open arms. Of course, Ghanaian jollof is the best jollof in the world. I enjoyed the jollof, the banku. I tasted that. It was very delicious. Safety hasn't been a huge concern here. Of course, anywhere you go that you haven't been, you want to take some cautious measures. You know, you want to be respectful to the people and the cultural norms there. Nothing more extreme, no more or less than any foreign country I would travel to. Yeah, the nightlife seemed electrifying. It was lit up. The people were vibrant. It seemed like people, the later it got into the night, the more people came alive. So the highlight of my experience in Ghana was probably when we visited the school, Ridge School. That was, it felt like I was a celebrity there. They were so embracing and seemed so excited to see us. We got to play games, we danced with them, they told stories, they had questions for us about America, and we had questions about how they grew up in Ghana. So that was by far my favorite, just getting to connect with the youth. To describe the environment at the hospital, it was very friendly. It seemed like everybody was a community. No matter what position they held, everybody was friendly. Even though they were taking care of people and it was a serious matter, it felt lighthearted. It felt like everybody knew each other. It was like just caring for a family member, it felt like. So yeah, I enjoyed, you know, even if you were a stranger, you felt welcome there. And I feel like you could be at ease being cared for, knowing somebody, you know, really, you know, care for your best interests. I would say the biggest differences in the healthcare system is what they prioritize. I think in America, cancer is one of the main things we focus on, cancer prevention. We do a lot of screenings, and we focus a lot on how can we care for people who may be exposed to cancers. But as we talk to health providers here, cancer wasn't as prevalent as it is in America. You have different diseases and illnesses that Ghanaians are exposed to, like malaria and different, you know, illnesses. So I think the type of health education provided varies based on what people may be, you know, exposed to. Some of the skills I've acquired, probably communication skills. Everybody doesn't speak the same language, and you have to really read body language and really understand people. So I feel like I improved on my communication skills. I honed in on really listening to what people said. It can be a language barrier and people can pronounce certain words a bit different. So I think just my ability to communicate and be patient with people are some of the skills that I've gained while here. So while at the hospital, a lot of our work was done in the NICU department, and we visited various locations kind of based on size. We visited the SDA hospital that was a bit smaller, and just seeing how they care for the babies so passionately, even if they didn't have all the resources that other hospitals may have. They still provide the same quality of care. And just to talk to different people at the hospitals and the way they plan and their healthcare system was so ingrained in, just caring for the people and staying up to date on what the community needed. So that really resonated with me as a community health worker, just being involved in the community and going to the rural areas and making sure people had what they needed. As a community health worker, that meant a lot to me, that no person was forgot about. They would go to whatever measures necessary to make sure people were cared for. Yeah, I'm super satisfied with this program. I think in such a short period of time, we covered a lot of ground. We visited hospitals, we visited schools, we went to local museums, we learned about the arts, the culture of Ghana. The only thing is you can only do so much with a certain time you have. So I think we really did a good job at getting a world view of Ghana and learning as much as we could in a time period we had. The hiking was incredible. We faced a little adversity. The night before it rained, so the terrains were a bit slippery, and we really had to, I don't think we fully understood what we were getting ourselves into with the hiking, but I think that hike we went on was a great team building opportunity for us. I feel like we all became closer after that hike, and we went on a boat ride after. So it was like we went on the hike, it was a bit difficult, and then we went for a boat ride and really celebrated, us making it to the top. And yeah, I would definitely recommend this program to other students or staff, whoever wanted to come out here. I think it's a great opportunity to learn about a rich history in Ghana. You share your personal stories with the people here, and they are open to sharing theirs. What I love most about this program is the ability to meet people from different fields. You meet health professionals, you meet teachers. It's like everywhere you go, you meet a new person and you get an opportunity to build and really have an impact on your life. So yeah, this would definitely say this trip impacted my career goals. I think I had a smaller scope of what I could do and how I saw the world, and just expanding on a global level, seeing how other cultures live and strive in their communities, I think will influence how I do my work back home. And the world is bigger than I thought it was, and I really think I can expand and grow even further and connect with even more people now. My most valuable lesson I've learned while in Ghana is just to be open to different opportunities and just try not to predict what can happen. Just be open to whatever. Yeah, the 3 words I would use is community, love, and passion. That's been kind of the highlight, and everywhere we went, people were passionate about their community. They were loving and inviting, and yeah, I think that kind of highlights what we've experienced while we're here.